Hello, everybody. Welcome to the American Rescue Plan Act Stabilization Fund's final report, part 1 webinar. And today's webinar is going to be recorded. Remind me to remind you several times about where our new, all of our COVID grant information is going to be. We're going to migrate it to one place and make it really easy for you to find. But we'll also be sending you a link to this webinar when we get it uploaded, as well as a link to the final report or attach the final report. So today's webinar, again, is for the ARPA S, is what we refer to it, the American Rescue Plan Act Stabilization Funds final report. There's 2 parts. This is part 1. There's not 2 parts to the webinar. There's 2 parts to the final report. And it is being hosted today by our wonderful colleagues at Child Care Aware of New Hampshire. The lovely Donna Lake is going to play point. And I am with the New Hampshire Department of Health and Human Services, as you probably all know by now, in the Bureau of Child Development. I'm going to talk very quickly today because we have a lot of material to cover and we want to get to the questions. The way that we have set up our webinar today is that everybody is muted. And we're going to ask you to put any questions that you have throughout the webinar in the chat. It isn't an interactive chat. It's just to help us keep track of the questions, because those questions will become the basis for our FAQ document. So we will be going through the various sections of the final report. Those of you who were with us yesterday with the CRISA, there's similarities, but there's also some significant differences. And if you're wondering if the ARPA stabilization is different than the CASP, no, it's the same thing. Remember, if you know nothing else about me, I am an acronym nut, and so I named it CASP before we knew what it was going to be called. But now we all refer to it as ARPA-S. So it's the same thing. Let's talk about a few logistics as we get started here. Oops, it is. There we go. So first of all, like I said, everyone is muted so we can all hear well. If you're having any difficulty, you can email CCRR at SNHS. I don't know. I can't talk today. Sorry. SNHS.org. If you want to ask questions or make comments, that would go into the chat. And as we said, the chat is an interactive chat today. It's going to help us track all the questions to develop the FAQ. And if you're participating by phone, you can send an email to that same email address, ccrrtraining@snhs.org. If you'd like to get some professional development hours for this, it says this evening. It's optimistic, isn't it, that the day is over? For today's call, you can, on your computer, put your name of your program and your full name in the Zoom chat. And if you're participating by phone, then you can send an email to that same email address, ccrrtraining@snhs.org. Be sure to include the name of your program and your full name in both of these. If you're sending it by email, just remember to include which webinar it was, because as you know, we're doing quite a few. So this is a little different. And if you were on the CRISA call, we've changed this since last night. We're making a lot of changes, hoping to make things easier for you all. Ordinarily, we would put this stuff under that COVID tab under the financial resources. But what we decided to do is to go ahead and to a great extent, get rid of that and move this information. We're creating a new page as we speak called COVID Provider Grant Funds. And it's going to be in the provider section of New Hampshire Connections. In addition, though, I will be sending out an email that has the final report attached to it with the instructions and a lot of other pieces, which I'll be talking about throughout this session today. Just a reminder, this is being recorded. So if you need to jump off or if you know somebody who couldn't make it, not a big deal. It'll be there for you to listen to. In addition, there will be added webinars that will talk about each of the funding categories If you would like to join us for those will also be recorded and posted. So jumping back to the beginning here, I'm Diane Chase. I'm the Assistant Bureau Chief in the Bureau of Child Development and Head Start Collaboration. And I ended up being sort of the self-appointed COVID child care provider funding coordinator. Sounds very impressive, doesn't it? My job was to make sure that all of you got the funds that came from the Fed. So that's what I've been doing along with my other duties. And all of us have had a lot of time together over the almost 3 years, we believe that. And so it's been harrowing. It's been a real pleasure to serve all of you. And I'm looking forward to all of the wonderful feedback you'll be giving through the final reports. So let's talk about what we're going to talk about today. First of all, we're going to talk about a quick overview of the grant, just as a reminder. We're going to talk about the final reports. There's 2 parts in the format, and how to allocate and report your funds, what resources are there to help, and then we're going to answer some questions. So first of all, and I'm going to refer to it as ARPA. Let's take a look back at what the grants are. Before I go on, I just want to tell you, you will be getting from us an email. We're starting to work on them. I'm hoping to get them all out by early next week. That will have in the body of the email, we'll have a summary of the funds that you have received in the 2021, 2022 fiscal years that are the ARPA related grant funds. So that means you will be able to see what funding you received from for CRISA, if you got CRISA, from ARPA, from the CCDF quality incentive, and that's it. It will not show your absent due to COVID or any of your other funding, but it'll show those 3. Oh, and if you did receive NHEYP, which is the New Hampshire Empower Youth Program funds, very few of you crossed over to that area. That was those funds are for middle and high school, so they didn't apply to a lot of you. But you will get that. There's 600 and something of those that need to go out, and my colleague Karima Barnett is in the process of cutting and pasting. And in addition to that, you will also receive an updated copy of the informational memo that we put together that has some change dates, and will tell you how to access our grant help desk, which is how you can ask us questions and not through email. We're getting so many emails, I'm afraid that questions will get lost. So let's move on. So the grant itself, as you recall, the intended use of the funds were to rebuild a stronger childcare system that supports developmental and learning needs of children, meets parents' needs and preferences with equal access to high quality care, supports a professionalized workforce that's fairly and appropriately compensated for the essential skilled work that they do. So that's a very lofty and high ambition, and many of you are all doing that. But the key word here is rebuild. There was an acknowledgement by the Fed that we were in fact needed to, in the second paragraph, you'll see, address the financial burdens that came with the whole COVID-19 public health emergency and the instability that it brought to the child care market. So that was the purpose of the funds. This was, if you think about the chart that we developed, there was the initial emergency, sort of the disaster funds. Then we had the Gopher funds that were the CRISP program and the something else, CAS program, I think. And those were the beginning of this sort of rebuilding, but stabilizing, helping people hold on. I think all of us entered into the public health emergency thinking it would be much shorter than it was. And these funds were the first, CRISA, which still dealt with income losses. This was really to restabilize the field, and was a large chunk of change that went all across the country. So what were the parameters and requirements? You had to be an open or reopening program at the time of funding. You had to serve children between the ages of birth and grade 5. And there's obviously a little wiggle room in that in terms of the grade 5. There were kids that were, summer programs where kids were going into 6th grade. You had to be willing to provide the data that was requested. You had to be a New Hampshire childcare license provider or a license exempt that was, you had to be enrolled in the New Hampshire Child Care Scholarship program if you were license exempt. And it applied to all of our license exempt providers, facilities, as well as family, friend, and neighbor, and all of our licensed providers, including center-based and family childcare homes. You had to be willing to comply with the agreement requirements for documentation, the use of funds, updating your NHCIS profile, participation on data collection, etc. And part of the grant overview that we will be doing is looking and making sure that you have complied with all those requirements, and with basically doing a checklist. And if you've left something out, we'll let you know so that you can course correct that. You also agreed that 25% of the grant funds will be for staff recruitment and retention. We'll talk a little bit more about that, and to align your spending with the allowable uses. Now, what's the final report, the format and the schedule? So, as for those of you that were on the CRISA call yesterday, you found out that we did some spot provider input. I've listened to all of you over the last couple of years and what works better and what's challenging. And so we've made some changes to not only the format, but how you'll be accessing it. So the final report has 2 parts. Everybody does both, but there's to the extent to which you report to each one varies about your funding. So the ARPA stabilization, the final report 1, which is what we're talking about today, that is due on February 17th at 11:59. You can turn it in before then, but that's the deadline. And it includes a basic Word document that has some basic questions. And we may go ahead and put that into the program level spreadsheet if we can, so that you'd only end up with 2 things. And then there's 2 spreadsheets. And the reason we did 2 spreadsheets was because we figured in some of your organizations, somebody's going to be working on that financial spreadsheet and someone else is going to be doing the program level one. And we didn't want to burden you with having to figure out how to do file sharing if that wasn't something that you do. The other thing is, this is what you'll do is you'll complete it and you'll attach those documents to an email and email them in. If for some reason you're unable to email them in, you may mail them in, and they will need to be postmarked by the day after the due date at the latest. And so we'll get those in our office. Also, if you are not very tech savvy, which I know some of our providers are a bit challenged, that's okay. You can fill out the documents by hand. Please make sure if you do that, your handwriting is very legible. And we'll be talking about all sorts of technical assistance that's available. Ideally, it'll be filled out on the computer and it will be submitted by email. Now, the second part, so what you'll be reporting on in round 1 is you're going to be reporting on your spending, how you spent your funds, the programmatic level information, which is the things that the Fed asks us, enrollment, staffing, wages, cost of care, those sort of things. And then some basic, benchmark questions that they ask, like, who are you, what your program is. They have those ethnicity questions, and a couple other things that will be part of this document. So that everybody will complete and submit, reflecting the financial spreadsheets will reflect how much money you've gotten so far and what you have spent it on. Now, some of you got additional funds that you haven't spent yet. Some of you had a invoice or something, or a check that got misplaced. And so if that is the case, especially when you get that summary of what funding that you got, make sure that you got it. We'll research it if you didn't. And we will, look to see if the checks were mailed, see if they were cashed, etc. But you'll be reporting in that first report, as I said, the money you've received and the money you've spent. If you have not spent all of your money, then you will not report that until the final report. So that first report, again, is basic Word document with 2 spreadsheets. It's got program level information and your spending. If you are done with your having spent all of your ARPA stabilization funds, when it comes to the final report, which is due after the end of September, you will not be required to attach a financial spreadsheet at that point. You have already reported what you did with your funds. For those of you who haven't finished spending out your funds, then yes, you will do a financial spreadsheet that reflects how you spent the rest of your money between when you submitted the last report and now. You can pick the end date. So right now, the way that the spreadsheet is laid out is that it covers funds that you have spent through December 31 of 2022. So the final report too will cover any funds that you spent after starting 1/1/2023. Again, there'll be a very basic Word document. It won't be redundant. It'll ask for an update though on your enrollment and things like that. And really basic information. So it's down and dirty and really fast. A lot of it you'll be able to populate in advance. You just need to know as of the last day of the workday of September 2023 what your stats are, because we have to report that up to the Fed. So what's the format? So like I said, there's basic information on a Word document. It's going to ask who you are, what your program is, and how to contact you, those basic things, what type of program you are, whether you're licensed, exempt, the basics. Now, what you're not seeing here is you're thinking, oh, is this going to be on SurveyMonkey? No, we listened to what you said. We knew that you needed time to be able to go back and forth. There's always the challenge of those custom links that you may or may not be able to go in and out. So what we have elected to do is literally do it as a Word document. We'll give you instructions on how to save it. As we said, if you want to handwrite it, not our first choice for you, but if it has to be done, then it's more important to get the information. Same thing with the other things. But we're not going to do it on SurveyMonkey this time. Again, so that you'll have a copy, you'll be able to work on it as needed, and you'll be able to refer back to it. Then the second piece is that program level information that's on an Excel spreadsheet. And again, we separated the 2 spreadsheets because we wanted, let's just say, the director's working on the program level information while the bookkeeper's working on this spending category. So we will likely eventually merge those ourselves, but that's not something that you have to do. So that program level information will be that point in time enrollment, capacity, staffing, wages, those sort of things. Then the second spreadsheet is the spending by category with a subcategory detail. And there's a place for a comment section. And when we talk about in a moment, I'll show you an example of that form, and we'll talk about how you're going to record that. Doing it electronically will allow it to automatically populate in different sections, which will be really helpful and time saving for you. The categories that the Fed laid down that we will be reporting on are personnel costs, rent, mortgage, utilities, personal protective, purchases, it should be or updates to equipment and supplies, goods and services, and mental health supports. Now, don't worry if you're looking at that and saying, well, but we spent money on marketing and we spent money on transportation. We will have the definitions for each one of those, and you'll see where you fit in those categories. These are just the categories that the titles of the categories that the federal government gave us. And then lastly, you'll be talking to us, and this will be back on that basic info Word document, will be the impacts of the funds on your operation, staff, and families. So what could you use the funds for? Again, remember we had that 25% off the top of your award that had to be used for staff. We call them incentives, which were recruiting, retention, for example, wage increases, bonuses. There were also the optional incentive add-ons, which you'll be reflecting on and tell us what you did related to those. But the biggest thing is there will be a place that it will calculate out what your 25% was, and then you will tell us how you utilize that. Now, I do want to put a caveat on that you don't, the 25% minimum did not count with round 2. So it only counted on your round 1. So for those of you who were extra diligent and put 25% of your whole award amount, rounds 1 and 2, and in some cases round 3, not to worry. That's wonderful. And you could do it, you could do a lot more than 25% if you wanted to, but that was your minimum. And the remaining funds had to be used for at least one of the following expenses. And again, this is just a little more information. It's that personnel, it's the rents, the facility maintenance, insurance, transportation, etc. All of those sort of things. And again, we'll be going into those specifically. So these were the financial categories as defined by the federal government. Those will be part of the instructions on the spreadsheet. If you're looking at them and you're looking at the allowable uses chart, which we will update, and that will be on the website, and you'll get a copy of that as well. And you say, I don't see where something fits in. So I can think of some immediately right away that I'm thinking, so where do they go? Those are the kinds of things you can reach out with us. You can ask through that grant help desk, which is questionnaire, which is on SurveyMonkey, but also we're going to be doing those individual webinars to talk about each one of these areas and what falls into them. So for example, at first glance, you look at it and you say, well, I don't see where I paid for newspaper advertising for my to recruit staff. Where does that go? Well, that one might go under personnel costs. It also might go under some of your goods and services, depending on how you did it and what you did. Where did we bought a new bus. Where does that go? I don't see transportation. So we would, that is likely either going to go under goods and services or equipment and supplies. And sometimes we won't know the answer and we'll have to reach out to the federal government. Now, here is the good news. We don't want your receipts. We don't want your individual documents. We don't even actually, unless you want to define it, want the actual name of where you spent something. It's going to be in the subcategories. So the form looks like approximately like this. We're doing some tweaking. So this is the cover page, right? It says what the expenses for each one of the quarters. This would be populated from the other tabs automatically. But if you do it by hand, you'll write it in 2 places. And then what happens is you do the, you go into each one of these and you will list what you spent your personnel costs on, what you spent your rent and mortgage and utilities. And again, falling under the definitions. So, for example, here is an example of what you might, under mortgage, rent, mortgage, utilities tab, you might put replacement of playground equipment in early childhood area, cost us a little over $6 grand. We made mortgage payments. to the tune of 12 grand for 6 months. As you will notice, it doesn't say that you installed 3 slides and 4 climbing pieces of equipment that you bought through Lakeshore. That is not information that we need, but that is information that you need to keep in your documentation, because when and if we get audited, and we do know these federal funds in all areas, not just childcare, are being closely scrutinized. They traditionally come in, and both our internal auditors as well as federal auditors, they pull a sampling of programs, and then they'll go out and say, okay, how does this back up the final report? And they'll have the final report, a copy of the final report. There's also a place for comments in the side of that Excel spreadsheet where you can add more information. So if it's something that is really unclear, or it says expanded play area. If that's if you didn't define it clearly enough, then you might want to say, this is what we did. We replaced playground equipment, added new licensing compliant ground cover, so on and so forth. So there'll be an opportunity. So if you think about it, the message that we're trying to say is we use these funds as they were supposed to be used, and then we use them how they were supposed to be used, and that they fall into the allowable uses. So anything that you do to define that is helpful. But again, you'll see there isn't anything here that says, we paid right here, for example, under goods and services, newspaper ads for new staff. There isn't anything under here that says that we paid it to the Concord Monitor or to Foster's Daily Democrat. It just says that we ran ads from here to here and how much we spent. And again, if you want to define that more, if it's not clear in the comments, you're welcome to. But as long as it's clear in the definition of how you spent the money, and that somebody can look at this and say, yep, that fits right into those allowable uses, that's plenty of information. For example, here's mental health supports, a day spa for 10 staff. Yep, you could have done that. So that's a wonderful mental health support that you might have done for your staff. And does that count towards your 25%? I would make a case that it does, because it's part of the retention. And this is part of recruiting. So there'll be a place on the bottom of each one of the spreadsheets that says, what amount counted towards your 25% set aside for recruiting and retention. Now, you may be under this tab and there's nothing that feeds into that 25%, but in other things there may be. So don't feel like you're limited to just putting it under the personnel tab. Then the last part is the impact narrative. And that's where you're going to be speaking to, and it'll be more eloquently put than this, but you'll be speaking to what the positive impact that the ARPA funds had on your program. And if you go back and look at that goal, the goal of the childcare stabilization was to provide financial relief, which it did, to childcare providers to help defray unexpected business costs associated with the pandemic and help stabilize your operations. So you will be reflecting back on, okay, we spent our money in all of those areas in the tabs on the bottom, and how did it impact, sorry, make you dizzy there. Yeah, and how did it inform this goal? How did it help meet the Administration for Children and Families, Office for Child Care goals when you spent those funds? And again, I said this yesterday in CRISA, and I will say it again today. This is not a challenge of your wordsmithing capability. We don't have a red pen and we're going to be correcting it. We're interested in as much information as you can share with us. This isn't something that will have 3 lines or 2 bullets. This is a big question. This information will be shared in aggregate form, which means it won't be tied to a specific program. when we share it in our final report of the final reports, but it will say, the, it will give a snapshot of what the ARPA funds and the impact they had on the state of New Hampshire. And that is what the federal government is looking for. And so really think about what you want to say. And again, don't worry about it wordsmithing, and make sure it's grammatically correct. That's not this isn't a test. This is really to get your feedback. There will also be a place for you to talk about what could have been more effective, more helpful, besides more money. We all know that. But what could have been the things that could have with this funding, if they had allowed additional things. When is it due? Again, I want to remind you, it is due on February 17th at 11:59 p.m. And there'll be all kinds of support, which we'll talk about in a minute, to help you get this done. If you get it done before then, feel free to send it in. The good news about this is because it's not, we're in control. If there's something that you realize, let's say you submit it on January 15th and you go, oh my gosh, I didn't include, or I want to add this, you can reach out and ask it to be added to your report. Or we can reject your report and send it back to you, and you can make tweaks. So that the only thing I ask is that when you're saving a document or you're sending in new information, there'll be instructions on how to do that, but make sure that you're really clear about what final version we're supposed to keep. So let's talk about how you allocate those funds. So first of all, remember that the ARPA S grant is different than the CRISA grant. Very different in terms of what it could be used for. ARPA's specific use was subgrants to cover, and those are the headings that we talked about: personnel, rent, mortgage payments, facility maintenance improvements, so on and so forth. And that they definitely, the use of those funds does not include, and I'll keep saying this over and over, does not include income losses. And we'll talk about how it address that in a different way. Again, some of the examples of the areas that it can be used in, it cannot also, and this is a really big one, remember this, cannot be used for direct care services, can't be used for tuition. That is not the purpose of this. This was focused on operating expenses, stabilizing your organization, being able to continue your operation and go forward. That is the idea behind this. Keep your staff on board. That was the idea behind these funds. Now, how do you recoup those funds? That if you had income losses, and you could do that through CRISA, is their rationale is that by reimbursing yourself for expenses, and this is a key thing, expenses that you incurred between January of 2020, and you go to that allowable uses list and you say, is there something that I paid for between January 2020 and September 30 of 2022 that I can apply these funds to. That is in fact sort of the trade-off for the income losses. So there you are recouping operating expenses that you had paid out of pocket. So as you recall, I'm not telling you anything you don't know, you had expenses and very often didn't have income to offset those. So this is the place where you can recoup those expenses. I also want to point out, you could fund facility improvements and minor renovations. And that's renovating bathrooms or making improvements and renovations necessary to ensure things are safe for children. You cannot construct new facilities and do major renovations. That is a absolute no. It's defined. We gave the reference here if you need to look it up. But that is a very clear for all of the ARPA funds, regardless of what area they were funded for, across the country, whether it was for medical or childcare, et cetera, is you cannot pay for those major improvements. I mean, new facilities. So you can't add on a room. However, if you added on a room, you could use these funds to pay for the windows, to pay for the flooring, to pay for the cabinetry, to pay for an architect to draw you a design, all of those sort of things. But you can't pay for that construction or those major renovations. Again, if you have questions around these, do not hesitate to reach out and through the grant helpline and ask us questions. We are happy to either try to answer them ourselves or go to our federal partners to get the answers. The two areas where we won't be able to help you, but we can certainly refer you out to somebody, is those tax questions, tax/income questions, and the and legal questions. Not because we don't have an opinion, and as I always tell folks, I have an opinion on everything, but this is something I'm not going to share my opinion, and those helping you won't as well, because those are very specific to your program and have a lot of legal regulations associated with them. So going back to that income losses, again, what are not covered is definitely, they're not covering income losses, they're covering expenses. So again, think about that. But the way as you recall when we talked about this, if somebody showed up at my house today and offered to pay all the operating expenses in my home for 3 months, 4 months, what would that allow me to do? Well, that would allow me to use my income for other things other than paying for the electricity, paying for the mortgage, so on and so forth. And that's the concept behind this money. And when you're thinking about how you're allocating your funds, think about stabilization. So, you know, again, when you go back and you look at how you applied these funds, and, you know, all of these things that are listed here are some of the things that you could do. These are freed up income. So once the bills are paid, right? These are things that you could do with that money. These are not covered costs, for example, helping families pay their bills, but they are areas where you could use that freed up income. Now, what documentation are you going to need? First of all, you don't need your application, your any of your quarterly reports to inform your final report. Those were projections, so you didn't have to spend your money in line with what you said your operating expenses were in your application. That was to help us assess what the operational costs were for programs, and therefore be able to create a funding profile that and a funding formula for getting the dollars out the door, as well as doing our due diligence that you're an actual operation, paying bills and those sort of things. But you could, for example, decide that what you were going to do was use all your funds towards staffing expenses. That's perfectly fine. Now, there's some places where some folks have reached out to us and used their funds or wanted to use their funds for a one and done that are not necessarily going to align with the grant goals nor the Fed requirements. For example, paying off things during the sale of your program and things like that. So if you've got questions about those, again, you put a request into the grant help desk that you want to have a one-on-one conversation. That's something where we would probably bring our federal partners in, which we have in the past. And again, that is a place where you'd be getting legal and tax advice. And we're not going to tell you, we're going to tell you what is allowed under the grant funding. and under the federal guidelines, but we're not going to inform you as to the decision. That'll be based on the advice that you get from your professionals. What should you keep? Obviously, sources for your application information, operating expenses, your final award letter. Remember that you applied for this on NHCIS. You submitted your grant agreement on NHCIS and your invoices for round 1 only. So those are there if you want them. You can download those and print them. For round 2, you submitted basically a confirmation request. And then, of course, your quarterly reports you submitted on the SurveyMonkey. There is, within that grant help desk function link, you can request copies of your reports. Please be patient. They are very tedious to pull down. They have to be done one at a time, and you'll see there's a huge list. So if you don't need them, don't request them. Or if you're needing them for your records, but not because you need some information off it to do you feel like you'd want to look at it before you do your final report, indicate that, because it's the people that want it for their final report that we're going to work on pulling first. Now, like I said, you should keep all of your receipts, your invoices, the payroll, the check stubs, all of those sort of things. Some of it you needed when you were completing the quarterly reports, but the reality is where you're really going to need that is when you're going to be doing your, if you get audited. So again, you won't be telling me that you spent $1.55 for, new pens for the front desk. So you could have clean pens, but you will be putting that you spent X number on office supplies. And you might tell me that the office supplies were things that were put in place to ensure, that health and safety around COVID. But if an auditor shows up, they're going to say, okay, in this category, in this line, what'd you spend the money on? And so that's when you will show those. Last but not least, technical assistance. So as I said, the final report template and instructions, they're going to be on that New Hampshire Connections under the new page. We're hoping to have that up by Friday. Worst case scenario, it will be the 2nd. And that will be, you will also get an email. That won't be your only source for the report template. You'll get an email that has it. If you don't get an email by the end of the week that has this template, because I now have to redesign it because we left SurveyMonkey, and I'm going to be working on that this afternoon and this evening. If you don't get that, please go into the help desk, and you'll see that listed. There'll be a link on the New Hampshire Connections website. Pop in there and put in the new address, and say, hey, at this address, I'm not getting anything. Also, remember that you're required to update, as part of this grant, update your NHCIS profile. And as a backup, if I very often go and pull down the entire email list from the Child Care Licensing Unit off of NHCIS, and sorry, my consultant, and they will, hold on a second. I'm going to mute for one moment and close the curtain. Thank you, everybody. The virtues of working at home. We are going to put the, you need to put those updated email addresses in there, because every time we do a mailing to all childcare providers, we get a minimum of anywhere from 30 to 50 that bounce back. And again, please don't send emails, because I'm really afraid I'm going to lose track of the emails. When I am trying to go in every night, I didn't get a chance to do it last night, but I'm trying to go in and answer each one of those emails and or help desk requests. for the grant. This is not for NHCIS. If you're having problems with NHCIS, you put that support ticket in there. But if you are, this is any questions related to any of the CRISA, ARPA, NHEYP, or the quality stuff. I try to go in every night, look at those, answer the questions, shoot you an email and say, hey, this is coming, or start to work on whatever you need. And that's a great place to just say, hey, I need a one-on-one meeting, or I need some technical assistance, and I can refer you to technical assistance. A lot of your local organizations, including a lot of your childcare network groups, your Childcare Aware, Early Learning New Hampshire, among others, are all providing technical assistance. So don't hesitate to reach out to them and say, hey, could you help me if you get in a bind? And also, we are certainly here to help you. So that is, as quickly as I could go through it, the ARPA final reports. Just as a reminder, before we jump into questions and answers, you will be getting 2 emails from me. Email 1, not necessarily in this order, will be the ARPA final report template, the allowable, an updated list of the allowable expenses, a revised version of the informational memo that I sent out the other day, and basically anything else that I can think of to attach to that one. And it will include, of course, the link for the help desk. And then the second email, or the other email you will get, will be the one that gives you a summary of all the funding that you have received. And this does not include the CRISP or any of those. That's over and done with. You've done everything you needed to do there. It will give you your ARPA stabilization rounds 1, 2, and in some cases 3. It will give you CRISA income. It will give you the CCDF quality incentive funds. Bear in mind that CRISA also paid for the absent due to COVID, but that will not be included, and you will not be reporting on that. So this is, just put that out of your mind for now. And this is to focus strictly on the grant. So that being said, Donna, what have you got for me for questions?
Okay, so could you please reiterate the dates of the ARPA spending window?
Yes, the ARPA spending window is January 1st of 2020 through September 30th of 2022. 2022? I'm sorry, 2023. Ooh. Yes.
Right?
Yes.
I'm still not, I can't even get over the fact that we're going to be in 2023.
No, me neither.
Facility improvements and minor renovations, roof improvements due to poorly insulated HVAC system that created a hazardous kitchen area. Are those covered?
Yes.
And if work was initiated during January 2020, September to September 2022, but actual work wasn't done until October, November of 2022 due to availability, is that covered as an expense in appropriate time?
Yes, and let me reiterate, and I apologize if I confuse people. We, the state, had to do what's called encumber the funds by September 30th of 2022, which means we had to make sure that we had allocated them and gotten them out the door. Now, some people got checks after September 30th of 2022 because either an agreement got lost or an invoice or a check had to be replaced. That's okay. We did our due diligence. Your use of these funds is anything between January 1st of 2020 and September 30th of 2023. Now, if you already spent all your money and you already allocated it to the allowable uses, hey, that's great. Not a problem at all. But if you're still thinking, you know what, I think I am going to use some of that money, I'm going to redirect it and use it for something in the spring of 2023, that is perfectly okay. The difference is you'll be reporting that on that second report. But going back to that initial question, yes, it's fine if you paid for it in October of 2022. Now you can't pay for it something in October of 2023 because the drop dead date for spending is September 30, 2023. What else you got?
So it was mentioned that we don't need the quarterly reports, but on the spreadsheet, it showed ARPA summary sections by quarter. Does that mean we need to know what we did per quarter to match our final spreadsheet?
Yes. So what you'll be looking at is you'll be reporting on each of the quarters. So you'll be saying and again, they're general statements. So if I paid for staffing, let's say I paid for staffing costs, and it would say staffing wages and benefits. And that quarter, you're going to say how much you spent for 10 staff and how much you spent. You're not going to tell me who the staff are, and you're not going to tell me the breakdown of what the wages were versus the benefits, but you'll say when you spent it, because we report up to the Fed by the quarter. The formula that they're looking at is you gave out this much money in this quarter, and this much money was spent in this quarter. So they're looking at the spending trends or the allowable uses trends and correlation with when the funding was allocated.
Will the CRISA and ARPA report templates also be posted to New Hampshire Connections website or only emailed?
Yes, they'll be both posted and they'll be emailed. And they'll be the same document.
How about repaving, sealing a driveway as an expense?
I would think that would be covered. Nobody's asked me that. You know what? I'll reach out and ask our Fed, and I'll make sure that we have our answer by the time we do our webinar discussion. But if I, for some reason, forget that, shoot me out, or I'll put that. Actually, you know what? I'll put it in the FAQs. What am I saying? Yes, we'll put it in the FAQs. I don't know. I would think it would be.
And that's it for questions.
All right. Well, we did that with 4 minutes to spare. I'm impressed. I'm impressed by all of us. Again, this isn't meant to be torturous. This one is unfortunately a little more tedious than the CRISA because of the federal requirements for reporting. It was such a large amount of money that they distributed nationally. We distributed with these grants about $46 million directly to providers. So as you can imagine, and we're a small state, imagine some of the biggies. And so it's being very, very closely scrutinized. So I appreciate how much effort it's going to take for you all to put this, to document it. If there's any more streamlining we can do between now and when we finalize the documents in the next 2 days, we will do that. I've been a provider. I did lots of grants. So I totally understand about time and how much it would take. Plug away at it and we'll get there, and we'll get them in on time, and we'll show the fabulous work that we did in New Hampshire. 2 more questions?
Yes.
Sure.
If a hardwood floor can't be finished but must be replaced, is that covered?
Absolutely. Yep.
And does paying a bank loan count?
That, you know what, that I don't know. I will have to research that. I think if you took a loan to stay in business because of you had, basically income losses or large expenses during COVID, I would think so, but I want to make sure.
No new questions after that.
Well, thank you, everybody. Please a
Stop
safe,
recording.
okay. Everybody